The psychological explanations of schizophrenia. The first part to the psychological explanations of schizophrenia is the psychodynamic theory, which was suggested by Freud. He suggested that schizophrenia was the result of two stages: the repression to a pre-ego stage and attempts to re-establish the ego control after a traumatic event. He suggested that schizophrenia is an infantile stage with some of the symptoms reflecting these two conditions. The second theory is the cognitive theory. Although it acknowledges the role of biological factors, it also claims that the further features of schizophrenia appear as individuals attempt to understand experiences that they may have. For example, they may turn to others for validation of experiences. However, when this fails, they believe others are hiding the truth for them, and so they begin to experience delusional thoughts. The third theory is the life events theory. This suggests that people with schizophrenia often have stressful life events. Brown suggests that patients who have schizophrenia reported twice as many stressful events in their lives than a control group. However, he also suggested this could be due to high levels of physiological arousal associated with neurotransmitters. The fourth theory is the double-bind theory. This suggests that children who receive contradicting messages, mainly from their parents, were more likely to have schizophrenia than a normal control group. It is suggested that the double-bind theory prevents development of an internally coherent construction of reality and therefore leads to the development of schizophrenia. The fifth theory is the expressed emotion theory, which is defined as a negative emotional climate, normally including criticism, hostility, and a negative emotional involvement. It's been suggested that an expressed emotion environment could be influencing relapse rate, which is suggested by a study that shows schizophrenics have 4 times the amount of relapses if they are exposed to one of these climates compared to a low expressed emotion group. The last theory is the labelling theory. This is where a schizophrenic has symptoms which are deviant, which lead to being labelled as a schizophrenic or someone who is mentally ill. Therefore, this leads to a self-fulfilling prophecy and often can make the symptoms worse or it hard to be in a positive mindset about recovering. Evaluation of the psychological explanations of schizophrenia. Number 1. The psychodynamic explanation. There is no evidence to support Freud, apart from claims from psychoanalysis. E.g., Richmond found that schizophrenic mothers do influence the development of schizophrenic children. This was supported by studies which show that parents of schizophrenic patients do behave differently from normal mothers. However, this is likely to be a consequence of the child having schizophrenia rather than a cause of their problems. Number 2. The cognitive explanations. There is a lot of evidence for the physical basis of the cognitive deficiency. For example, it was found that there is a link between excess dopamine and the working memory. Additionally, this theory has treatment implications, as a machine was created to display hallucinations to patients, which will show them that their hallucinations are not real. Next is the life events. There is no solid evidence to support the link between life events and schizophrenia, and it was shown that people with schizophrenia are no more likely to have experienced a major stress event 3 months before the onset of schizophrenia. Any evidence that does show a link is only correlational, and it is suggested that it could be the onset that has caused the life events. Next is family relationships. It was shown that adopted children with biologically schizophrenic parents are more likely to be ill themselves. However, this only occurred when the adopted family were classed as disturbed. This supports the genetic environment interaction. Next is the expressed emotion theory. There is high universal empirical support for this theory. However, there is questions on whether it's a cause or a consequence of schizophrenia. The theory also has high treatment implications, as if the high EE relatives are shown how to reduce the EE environment, then it could reduce the relapse rates. Next is the labelling theory. It was shown in a meta-analysis that in 18 studies, 13 were consistent with this theory, and 5 were only inconsistent with the theory. This suggests that the labelling theory is supported. So that's the psychological explanations of schizophrenia. Please feel free to rate and subscribe, and I'll be uploading more soon. Thank you.